And one of the things, of course, is how do we frame single payer? So frames are mental structures that shape the way we see the world, as he says. And reframing is how we do social change. So, of course, we are interested in social change because we want to advance single payer. So here's this, I was only told 15 minutes. I could go on, but I'm going to get to the heart of a lot of the things I want to talk about, which is here's a chart that almost none of the single payer people ever put together, but it's one that I think we should talk about, which is how much do we spend on healthcare? Because that actually is one of the top questions that people ask for when we talk about single payer. And the answer is, for the first time, at least in 2020, we exceeded $4 trillion. This year, we are expected to exceed $4.2 trillion. I should tell you, these graphs were written before the COVID pandemic. So we know that with the pandemic, if anything, our numbers are even higher. In fact, just this past December, and a new analysis by the Office of CMS says that the 2020 healthcare spending in the United States increased by 9.7% to $4.1 trillion. In other words, another almost $100 billion more was added, because instead of spending 4.3% growth rate, which we were anticipating, it's actually went up something like 36%. So, and that's all because the federal government had to respond to COVID. And I just remind us that if we turn the whole thing over to the market economy and the private sector, what a disaster it would have been had we asked the private sector to fund COVID response. If you add that together over the next decade, let's say from 2020 to 2029, who can tell me how much will we spend on healthcare? Maybe you can put in the chat your guesses about how much you think that adds up to. So here's the answer. $51,783,000, $783 billion. That was before COVID. So given what I just mentioned to you, it is very likely that that number is an underestimate of how much we will spend in the next decade on healthcare. Now, I want to remind people that we have this long discussion about Build Back Better, which is $1.9 trillion over a decade. And we have difficulty trying to get a bill like that passed because we think it's so much money. Somehow or another, we do not talk about the fact that we as a nation will spend over that same decade $51.7 trillion on healthcare, as if, well, it's healthcare. We could just spend that kind of money. I mean, the point here is that most Americans cannot get their handle around the types of money we are spending on healthcare and how it is so far out of proportion to everything else that we really desire or need in our society. And who gets to control those healthcare dollars? Well, I'll give you a hint. It's not you, and it's not me. And the people who control health policy in this country are the ones who like it that way, because they get to control your healthcare dollars. So is it government? Is it the private health insurance companies, the doctors, the pharmaceutical companies, the medical equipment companies, the labs? I mean, all of them play a big role in this. But the big ones, of course, are the private insurance companies and government. And that turns out to be the big battle. And I think that if we start our conversations around, single payer, I think we end up actually going down this big rabbit hole. So, the private insurers will say, we're going to take away your insurance and you should have your choice. And then we talk about paying for health insurance premiums and then co-pays, deductibles, and pretty soon people's eyes start rolling over, And then a single payer, of course, we talk about Medicare for all. And the people come back and say, oh, that's one size fits all. And then you have to pay taxes. And then we have, instead of having a rational debate about how we should fix the healthcare system, we end up having a big debate about, you know, this issue about Medicare for all or taking away your insurance and all this other stuff. And I think it becomes and quickly becomes dysfunctional. So I want to sort of step back a little bit and say that we should start our conversations maybe on a different footing. And the question really is healthcare a public good or is it a market commodity? Do we think government's the answer or do you think the government's the problem? Do you think private insurance can't be trusted or do you think private insurance works, whatever that means, for 176 million Americans? And to confuse things even more, in English, healthcare has actually a dual meaning. You know, if this is Chinese, we'd have probably two different characters and pronunciations for this concept of healthcare, because healthcare is financing. So for example, people could say, people like their healthcare coming from Blue Cross Blue Shield. Or people can say, people like their healthcare from a patient, referring to maybe their doctor or the hospital. That is to say, healthcare has a dual meaning, both financing and delivery. And the insurance industry has been very clever about taking advantage of the fact that we have this dual meaning and using it to their own purposes. So for example, which is the real healthcare? Here's an ad from the Partnership for America's Healthcare Future. Americans don't want a one-size-fits-all government health insurance system. Now, some of you know that the partnership is really consists of, you know, the insurance companies, the medical industrial complex, the pharmaceutical industry, and so on. And instead of people behind, you know, what they really do is, you know, deciding which claims to pay and so on, they have this cute little girl with her teddy bear and a pillow and a hospital bed. And the implication, of course, is that they, the great insurance companies, are the ones who are responsible for the wonderful care that this person has received, this cute little girl. Instead of actually explaining what really happens and what they really should put in their picture is a picture of them sitting in their cubicles, deciding whether to accept or deny your claims, whether you should get your prior authorizations, explaining to people why people are in network and out of network and why your bill is now 4 times what you thought it would be, on and on and on. That is actually what really happens in the insurance industry. So the question is, which road should we go down? Do we take the road that says, well, healthcare is a market commodity, which basically says if you have no money, guess what? You don't get any insurance. And in fact, if you want to get insurance, the only insurance you can really get is private insurance. The Affordable Care Act actually says that the only insurance you can get in the marketplace is private insurance. And that, in fact, it's the dual allegiance that the for-profit insurance industry and can actually be owned by shareholders, and for-profit hospitals can actually control their hospitals. And then we spend our time asking doctors and hospitals to fill out electronic medical records so that they can profile themselves. And then the insurance industry has the benevolence of deciding to compare the electronic medical records of you versus that of other electronic medical records from your doctors. And then they rate you, decide who's going to be in their network and who's going to be out of their network. And what's their criteria? Is it based on quality of care, which they claim, or is it really who saves them a lot of money? So we have unwittingly, through our EMRs, created the noose, if you will, that we use to hang ourselves in our healthcare marketplace. And of course, we want people to have more skin in the game. So we impose high copays and deductibles on our patients so that they can think twice, theoretically, about whether they need that CBC and diff, or whether they need that operation for their aortic aneurysm or whatever. I mean, this is the absurdity of the whole thing. But the point here is that these high copays and deductibles mean that they change the risk over to the patients, not to the insurance companies. And the higher the copays and deductibles, the more they offload the risk to the insurance industry themselves. And then, of course, we have NIH funds, which we use to help come up with these great drug patents. You know, a lot of the Moderna vaccine came from NIH, but then we hand the patents over. At least Moderna actually tried to take over the patent for these NIH-funded programs. That's in contrast to if healthcare was a public good, where everyone would be covered. And what would that mean? It means that you pay what you can afford. You make a lot of money, you're going to pay a lot of money. But if you don't make a whole lot of money, you don't pay a lot of money. But yet, guess what? You're still entitled to getting healthcare. And the delivery system is only responsible to the patients themselves. The doctors are rewarded based on patient improvement. And you're not actually having to share your rewards with the shareholders who own the insurance companies or the for-profit hospitals. And there's no financial barriers to care. We wouldn't have to worry about all these copays and deductibles. We no longer have to worry about whether you're in network or out of network. We actually, you know, it would simplify the system tremendously. And of course, NIH research then would be spent on basic biology and treatments and not necessarily to create new patents for for-profit drug companies. Let's see. This concept of public goods actually has some benefits because actually we know what public goods are. We use it all the time. It's a service that's provided without profit to all, and it's funded by tax dollars. So we use our tax dollars to fund hospitals, schools, fire departments, wastewater treatment, the public health infrastructure. So in fact, as I mentioned earlier, you know, the whole COVID response and the public health response, we give the vaccines for free. We give the testing for free. We're about to give the masks for free to everybody in America. That's an enormous contribution. And who's paying for it? Well, we fund it by tax dollars, but we recognize that it's a public good to do this. That if we only let the market decide who should get the vaccine, we would actually have a very few people who would actually get the vaccine, and the rest of the people would be left out there to get infected and to cough it and spread it to other people. So it is to our benefit to have healthcare as a public good. And dare I say, even our national defense is a public good. We don't go out there, we individually cannot buy our own national defense, but collectively we bring our tax dollars together and we can actually fund a national defense for this country. So how do we pay for healthcare? Well, under the market-based system, we use health insurance premiums. And if you think about it, it comes as a fixed price. If you're a billionaire, Jeff Bezos pays the same as a health insurance premium as Joe Homeless, all right? Assuming Joe Homeless has money for it. He may have the money to pay for the copays and deductibles, and that's how maybe we differentiate the insurance companies from each other. As opposed to maybe if healthcare was the public good, it would actually be based on ability to pay, and it would actually be based on, dare I say, income taxes. But think about that. This helps answer one of the most common questions that people have about single payer, which is, who's going to pay for this? Well, if it's a public good, it's paid for like we pay for other public goods, which is through tax dollars. And if it's and how much will I pay? That's the other question people ask. Well, under a public goods system, it depends. How much do you make? If you don't make a whole lot of money, guess what? You're not going to pay a whole lot of money. But if you make a lot of money, you will be paying more money. Most people, the average middle-class person, will be paying far less money on through their tax dollars to fund a public good that collectively we all benefit from. The people who like Jeff Bezos and Elon Musk are going to be paying a whole lot more money than they're used to be paying right now, because they are the beneficiaries of a fixed price insurance premium that they have been able to get away with for the last 50 years of health insurance. So how will we transition to a single payer financing? Well, under the market-based system, for example, we have learned that employers have to buy higher deductible plans. Otherwise, their health insurance premiums keep going up and up. So what they do is they foist higher copays and deductibles on their employees because that's the only way they can keep their premiums level. Or they can take the money out of the wages they would have paid their employees, because then they would actually otherwise, in other words, you would be paying for your health insurance premiums otherwise. And insurers can also offer employers very skimpy plans. And in fact, increasingly employers do take skimpy plans because that's the way they can control their financing. I point out that slide earlier that we increased the amount of money in the pandemic by 37% because of government infusion of funds to pay for healthcare. Imagine, if you will, if we totally relied on the marketplace to do the COVID response. Do you think we would see the $15 wages that Amazon would be giving now and all the other department stores and so on? No, nobody could afford to do that. They would be jacking up the health insurance premiums for every single employer in this country. And the employers would respond by laying off more people on top of the pandemic, and or trying to give even less wages to their employees. So in part, the reason why we're able to provide higher salaries and hourly wages to the current workers out there is because the government helped fund some of this COVID response, and for most of the COVID response. Now think about how you could actually think about healthcare as a public good. Well, for one thing, the ultimate idea would be that employers would stop paying premiums. They wouldn't have to pay premiums. They could take the thousands and thousands of dollars they pay for health insurance premiums, and they could give it to their employees as an enormous salary increase. They could increase their salaries by thousands of dollars. It would be unprecedented. And even though we would now have a tax-based system, for most employees, unless you're, Elon Musk or something, most employees would pay far less in copays, deductibles, and premiums than they do in copays, deductibles, and premiums by just simply paying the taxes on their increased salary. So, you give your employees now $6,000 additional raise because that's how much you were paying for their premiums, and they raise their taxes, let's say, even $1,000, you still benefit by keeping the $5,000 for yourself. So the whole point here is that people are actually better off under a public good system, paying taxes, the average person, and then this current crazy, confusing way that we finance healthcare under the marketplace. To illustrate this, think about this graph. Consider that we pay $6,000 for an individual to get health insurance. Doesn't matter whether you make $600,000 a year or you make $60,000 a year or $50,000 a year. You are going to pay the same rate. It's the ultimate flat rate tax, if you will, is health insurance premiums. But from your perspective, if you're poor, you're talking about 30% of your income going to pay for health insurance premiums, as opposed to maybe 1% if you're a rich company or a rich individual. So the point here is that the current flat rate system that we use for health insurance premiums disproportionately impacts low-income people, which is why low-income people hate the current system they have and have a right to complain about it, because look how much of their premiums, copays, deductibles, and the low-wage workers they work for, employers they work for, are also complaining because they can't really afford to pay health insurance for their employees. As contrast to Amazon and Walmart and all these other big companies which can afford to pay higher. They can. If you're the top executives there, you're happy to pay a flat rate because it's like almost a meaningless amount of money compared to how much earnings you make. So this has been a huge bonanza, and it's one of the reasons why the rich do not want to change the system. They love the system they have right now because look how they benefit from it. Under a public good system, a much fairer way would be the more you make, proportionally, the more you you have to pay for health insurance premiums. And you could say, well, look, for a rich person, that could be almost a third of their income. Well, they still get to, if you make $600,000 a year, you still get to live on, 300 or $400,000. It's more than enough to live on, as in contrast to someone who's only making $30,000 a year. And if you really want to be much more progressive, you do something like this, where the vast majority of low and middle income people would actually have a small amount of money of their percent of their income used for health insurance or taxes. And the very rich who can afford it, the movie stars and the Elon Musk out there, they can pay a whole lot more money under a progressively funded system. So in other words, we're shifting the curve from a system, a flat rate tax system, if you will, which health insurance premiums represent, and disproportionately impacts the income of low income individuals, to a system where, as a public good, we would use like progressive income taxes to fund healthcare, and it would actually be a much fairer and much more affordable way of providing healthcare for the large number of people in this country. Tell me how I'm doing with time. Am I out of time?
You're getting close. We want time for Q&A.
Okay.
Yeah, about like 2-3 more minutes, Walter. Is that good?
Okay. So why should a rich person fund healthcare? Well, here's a quote from somebody. One summer when you were in high school, you worked at McDonald's in Miami. What did you learn about customer service? Well, he says, I learned that it's really hard. I was a cook. They wouldn't let me anywhere near the customers. That was my acne teenager stage. They were like, why don't you work in the back? That was Jeff Bezos. The same healthcare system, where if it was a public good, that would have covered Jeff Bezos when he was flipping burgers at McDonald's in Miami, is the same healthcare system that would cover him and his family now that he's one of the richest persons in the world. And the point here is that if healthcare is a public good, it covers you from cradle to grave, from whether you become poor and rich and poor again and then rich again. I mean, the point here is that you're covered regardless of what your financial status is. That actually turns out to be once you think about it philosophically, that's what a public good does. It's something that we all benefit from, regardless of our station in life. Okay, I will. I point out Medicare for All at 2021, but I'm going to stop here. I could go on a little bit about how it affects COVID, but maybe since I said I'd do 15 minutes, I'll stop here and see if there are any questions.
My observation has to do with the framing of some of our arguments. I mean, in the single payer movement, PNHP and others are always talking about the corporations profiting off of people's misery and so on and so forth, the moral argument. And somehow that seems to surprise them. And I'm wondering why it surprises them, because these corporations, if they're publicly traded or hedge fund investment financed, they exist to create wealth for their shareholders. That's why they exist, to increase the wealth of their owners. Yeah. And I think we have to ask, I mean, they don't make any secret of this. From their perspective, they're doing their jobs, which is to create as much wealth as possible for their owners. And they're not hiding this. So why are we surprised when this is the question is it their fault somehow? Are they to blame for the greed in the healthcare system? And you have to understand that if you're the owner of a private company or an individual, how greedy you are is optional. I mean, you decide how greedy you want to be. If you're the CEO of a publicly traded company or a hedge fund, your greed is mandatory. It's part of your job. And so you have to ask the question, who is responsible for the situation we find ourselves in? with the corporations making as much money as they possibly can. And it's not the corporations. They're just doing their job. So whose fault is it? And I would submit that it's our collective fault because we let them do it through our elected representatives. I mean, I was wringing my hands when I watched the Affordable Care Act being developed back, a decade ago. And I could see where this was headed. And the Democrats, I guess, were somewhat justifiably, I think, deserve credit for passing a very difficult piece of legislation. But, that has, when we framed it in the single payer movement as being something wrong. And I think we have to admit that the fault lies with all of us. The fault lies with the idea that we could put these, in other words, we have a guy named Bob McAfee in the Maine Medical Association, and he was president of the AMA while the ACA was being developed. And just recently, I've been working with the Maine Medical Association to try to get them to endorse the Maine All Care's idea of universal coverage. And Bob McAfee, who is now in his mid-80s, admitted, you guys were right. We never should have trusted the insurance companies. But I think he has it wrong.
Yeah.
Well, I think he has it wrong because I trust them to do exactly what they were created to do. So is that a better way to frame the criticism of how we got to where we are than blaming the greedy insurance companies? I've found that doesn't work very well.
Okay, thanks, Phil.
Well, that's my point, is that I'm trying to write a new frame that we should start our conversations about whether healthcare is a public good or a market commodity. I think the majority of Americans think it's a public good, but instinctively. And then once they start realizing that the path that we're going on with the Affordable Care Act is actually a market-based approach to healthcare. And in fact, we even name the individual approach to buying healthcare is, we call it the marketplace. That, I think, starts getting people to think maybe that's wrong, and that maybe philosophically we should have started off with the idea that healthcare is a public good. Once you accept the idea that healthcare is a public good, it's very easy to make the argument of why single payer financing is a better way of doing it. But I think Phil's major point is that why are we so upset when corporations are doing exactly what they're supposed to do, which is to maximize their own profit? And that actually, I think, is exactly why healthcare should be a public good, because if people's profit for the health insurance industry comes at the expense of the quality of care or the lives of individuals who are being treated in healthcare, that is a problem. And that conflict happens all the time, as we see. I won't go on because we have a lot of other questions.
Phil, yeah, good comments. Phil, thank you. Walter, Lou, Senegers. Lou, again, brief, please.
Walter, I really appreciate you talking about reframing the issue. I think we all realize that you're right about this. My question is, recently in Oregon, there's been a move in our legislature to offer the public option instead of moving forward in a single payer program. And the reason given is that it will lower the costs of other insurance companies. So can you help us here in how do we take your concept of framing the issue and apply it to a public option, which would be a government run insurance plan? Thank you.
Well, I think actually the private insurance industry is salivating on the idea of having a public option, because the one thing they want to do is get rid of all of their high risk and expensive patients and just dump it somewhere. And they can always, there's lots of evidence to show that the private insurance companies can simply deny claims to people who are very expensive to the point that they're so frustrated that they want to go to the public option, which of course now is saddled with these very high expensive people. So I think that it's the real problem is that we are where we are right now. That had we in fact thought about single payer right from the very beginning, we would be that much further along. And we wouldn't be spending 40 or 50% more per capita on healthcare than any other country in the world. Can you imagine that we bankrupt ourselves as a country because of the current system? So the insurance industry would like to define what's covered in the public option, I'm sure, and make it as more like the Medicaid most undesirable program that they can make it stigmatize it in some way, so that, oh, you got the public option. You know, that's what I think is going to happen out there. And unless we come to grips with the idea that the insurance industry is the pernicious for-profit corporations that Phil Caper talked about, I think that we're going to go down a bad pathway. I don't have an easy answer, frankly, except to say that I think we need to do a radical shift, and we need to re-embrace the idea of a single payer plan and make it a public good.